This presentation explains the epidemic management decision support system that DECISIONWARE is developing in connection with the novel COVID-19 coronavirus pandemic. We are going to evaluate the impact of using highly complex mathematical methodologies in the management of this type of pandemic. For this, we have taken as a reference the paper of the Imperial College that is in circulation and that has been recently edited on March 16 of this current year on the impact of non-pharmaceutical measures regarding the management of coronavirus and epidemics in general. Here are some of the examples of the type of measures the Imperial College looks at: isolation at home, voluntary quarantine, quarantine only for people over 70, the mandatory total quarantine, and mitigation measures such as partial closure of society's circulation, for example, by eliminating the activities of colleges and universities. The Imperial College simulation model allows simulating the effect of different policies and how they alter the pandemic diffusion curve over time, and is capable of mixing policies and analyzing the dynamic behavior of the pandemic, considering dynamic control measures that change over time. As a reference, we have taken Table 4 of the report, which analyzes different types of strategies to manage the pandemic. The first is to do nothing. The second is a total quarantine that is really very low complexity mathematical model that corresponds to a mental model. The third is a total quarantine mixed with mitigation activities such as the closing of schools. It can be solved with a simulation model, and the fourth is the mix of multiple control policy alternatives for managing the pandemic. Its exact solution requires a highly complex mathematical model. The results of the 20 cases they analyzed can be summarized below. High complexity models produce the lowest number of deaths, which is equivalent to reducing the potential of 432,500 deaths by 21,000 people. Very low complexity models, or models based on mental models such as the total closure of society circulation, only decrease the number of deaths to 84% and cause 57,625 more deaths than the highly complex model that is 168% increase. The medium complexity model, which can be interpreted as simulation models, presents intermediate results between the previous two. Paradoxically, the highly complex models, when we analyze many policies and their dynamic mix for managing the pandemic, in addition to producing the least number of deaths, produces the shortest time of society closure. Therefore, there is no justification for not using optimization models to control the pandemic. That is the conclusion or final idea that gives the Imperial College when it says that the biggest problem is determining what is the optimal mix of such policies. Taking into account the impact of this study, then, a decision support system has been designed following the principles of creating an hypothalamus organization, in this case the administration of the pandemic, which is made of various mathematical models which are integrated through an information system that stores knowledge and all the data that is generated before and during the pandemic. The first model is the supervision and control model, which is designed to model the triage or diagnosis of the pandemic and whose main objective is to produce information to calibrate pandemic models and close the gap between known or diagnosed cases and actual cases. The results of the supervision and control model are the fundamental input to characterize the pandemic, which is going to be associated with one of the mathematical models developed by epidemiologists such as SIR or SEIR or SEIIR or other different types of simulation models. So the final object is to produce the socioeconomic, regional, and seasonal parameters that allow us to study the pandemic in detail. Additionally, this model of the pandemic must include the modeling of control policies and aims to simulate what is going to happen in the future. Ideally, the simulation model should become an optimization model that determines which is the optimal policy for a dynamic point of view, defining which is the optimal strategy by dynamically mixing different control policies, as the studies show by the Imperial College. This produces the greatest benefit for society: fewer deaths and less time of confinement. In addition to this model, the entire logistic part oriented to the management of the resources of the health supply chain must be included, considering the optimal control policy and how that optimal control policy affects the spread of the pandemic over time. Finally, a layer of socioeconomic modeling should be included that considers the state of the different industrial sectors of the economy and how they are affected by the different control policies that the person responsible for controlling the pandemic may apply. In short, the hypothalamus of the decision support system must produce macroeconomic information, information on the consumption of resources in the health supply chain, and the description of what is happening with the pandemic. All these center around what is the optimal control policy to manage the pandemic. This, in computer terms, the mathematical hypothalamus is specified in several mathematical models that must be interconnected through databases or by means of equations when all the models are united in a single holistic model of the process. The computational implementation is based on DECISIONWARE's own methodology. That works with a team of expert modelers and the use of cognitive robots that are in charge of writing computer programs instead of using the traditional method of programmers writing programs. The fundamental advantage of using cognitive robots is the speed, precision, and quality of computer programs. Here are the most important dates in the development of the project. The blue arrows indicate when the prototypes will be mounted, and the strong green arrows when it is expected to have the models adjusted. The next week of March 31st should be the first pair of models: control of the epidemic and the logistic model. For interested people, you can find our contacts to establish any type of relationship, and additionally all the information that has been generated through this study.